It is my wonderful pleasure to introduce Lissanthea, who is a physiotherapist and is the founder of Better Rider Project. Is physiotherapy-led education and training initiative dedicated to enhancing rider performance and safety through the integration of human movement and science, skill, performance and research. However, the most important thing you should probably ask Lissanthea is how she survived isolation in a Chinese jail. So with that note, I hand over to Lissanthea.
Well, Ben, I didn't expect that you were going to introduce that. And you know, when we were playing around with the slides and realizing that I'm not going to present with my notes, which means I'm going to have to remember everything. I always go back to that, but you survived Chinese jail, you'll be fine. So I'll just keep on going with that. So I'll just, signal to you. Okay, so I want you all to just put your imagination onto, say, a normal Saturday morning lesson that you might be teaching. And you know, that moment when you finally think that your student has got it. They've nodded, they understood, they absolutely swear they know what they can go and do next, and they go back out on the circle and they do exactly the same thing that they've always done. So their legs are still floppy, they're still sitting to one side of the saddle, they're still gripping with their hands. And so what I want to hope to do in this session today is that I can introduce some things about skilled performance that applies to our normal riders. And I like that this has been introduced just a little bit. Can you do that?
Sorry, for some reason the mics are switched over. Yeah, there you go.
Yeah, okay. Hopefully that's working. So I'm going to introduce some of these ideas that come from the physiotherapy world around skilled performance. And for our normal riders, and these have been alluded to a bit already of our grassroots people that we want to be able to help. So these are, you know, the middle of our sport. You know, our learning curve as early learners is steep, but once we've managed things like that, then and not many of us get through to elite. But this middle point is probably where most riders also have the possibility of getting stuck, of getting frustrated, of putting in all of that effort and all of that time, and their body gets in the way of being able to make progress. So I've given myself permission to use my own B-roll photos in this. So you can see some of the not very nice things that I might do. And they're not terrible, they're not awful, but they're not great pictures of riders. So if we just go again, so this is what we'll do today. So just flick through these. So we're just going to recognise how some of our body patterns that might turn up in the saddle. You'll be able to describe some of these things that happen. So most importantly, that you can feel them in your own body, and you'll be able to go out and use them. And I'm wanted to be quite cautious about anything that might be sort of encroaching too far into coaching. I'm not a riding coach. My aim is that I can help riders develop the body skills that then I can hand over to a coach and be able to say, now let's get the horse and the rider working together. And I've sort of willfully kept the horse out of things just a little bit, because there's lots of ways that a horse will impact on skills. And also I haven't mentioned much about saddle fit, but those two things will also be really important to consider. And I've been told I've got a hard time limit, so I'm going to get cut off. So I'm not going to be allowed probably to take questions, but I will be here all day, and I really would like, if anything grabs your imagination or is interesting and you'd like to talk more about it, I've put my contact details on there as well. If you're coming down to the Yarra Valley, please come and visit us. We live at Wandon Park, which is a beautiful place also to be. And you can come and have a ride on Sven, who is my bouncy horse simulator, who's been a really cool way of teaching and developing riding skill that's off horse but very close to practicing in a way that would be, like if we think about the way we use different skills in different sports, you know, we don't get as riders the opportunity like golfers might to go and hit 1,000 balls. And my little secret is I wanted this for myself. And so I had done, I'd actually done lots of rider work about 10 years ago with New South Wales Institute of Sport. And then I went overseas for lots of years. That's the China jail story. And then I came back, I wanted this, and that's how we have the Better Rider Project, rather than physio for riders, because that sounds a bit boring. And people think you have to go to the physio only when you're injured, only when something's bad. I think in fact, all of our riders should come and see, can they meet the needs of the sport? We do that at Elite, but I think all of us actually could learn a lot. So before we move into the rider world, I thought we'd bring the horse just to the front. And yeah, there's lots. And I wanted to talk about the way that maybe this picture fits together with that definition of skilled performance. So I don't think we actually have a really good definition even for any of our levels of riding. But I think if we use that definition, and because that talks about the human in reference to the horse, the ability to apply pressure and release, so our learning cues, at the right time, the right duration, the right intensity. And so that's to help the horse move safely and comfortably, also within our human environments. And I think it's this kind of a definition that gives us something then to think, well, what are we trying to train off the horse? Because a lot of the things that even I might suggest as a physio and strength and conditioning and all of those things don't necessarily train the skill. They might train maybe human capacity to move things, but not necessarily what the horse needs. So I think when we talk about these ideas of skilled movement, I'll give myself as another example here, and I can use this to talk about the tricky subject of welfare. So I didn't need to put up a horse in a harsh bit. I didn't need to put up anything that lots of people within and outside the sport are rightly talking about. But if I could even think about this as its own kind of welfare issue, I've got a grippy hand. If I do that all the time, how is that going to affect that horse's learning? Don't have a particularly effective leg, not doing much there. I'm pulling on his mouth, that's probably pretty uncomfortable. He's also got he's in his favourite place, neck short, and and just plodding along on the forehand. We might say, oh, it's a not very nice photo. It's just a moment in time, it's nothing much. But I think if this is what is happening and we're doing all the time, and riders and coaches are unaware of the fact that this stuff can change, then I think we are maybe not thinking as widely about how we can make life better for our horses as we need to. Maybe just go through all those, yeah. Okay, so I'll just put all that up there, let's not worry about it. But I also want you to really understand that the skills that we develop in the body as riders are absolutely unique. Like, we don't use our body in this way anywhere else. So usually what our pelvis, which is our primary thing we're using in the saddle, our pelvis just gets told what to do by our feet. Our feet are what's in contact with the ground. And so we don't really ever have to build any kind of awareness of putting weight onto one seat bone, moving a seat and a hip together, keeping one still, moving the other side. Like, we don't have that kind of vocabulary in the human body, although the movements that we do in the saddle, which we'll learn later on, actually are what we do in walking. So when we know how it works, we've actually then got the ability to kind of bring information from other bits of the body, like the feet, into understanding and learning how the pelvis is going to work. To be able to learn a new skill, to learn a new movement pattern, we've got some factory settings of the human body, and they're the kind of tricky things that actually can get in the way. We were talking about boundaries to change, and something that's really important, that we understand that we can't get over these factory settings, which are mostly about fear and risk, if we are also only doing them in a kind of high risk place that requires a lot of concentration. Unfortunately, that is on the back of a horse. So we might have to always think off horse is not an optional extra in learning skills. It might actually be an essential place where as coaches we can develop some more skills to help riders get back on. It doesn't have to solely be me as a physio doing that. So we'll talk through some of our systems for staying safe. So we're going to go away from horse riding just for a little bit and kind of go a little bit more into the human body. Kristen? Okay, so, and again. So this is what your nervous system really thinks about riding a horse. And whether you feel scared or not, those systems are still there. They're on high alert. They're scanning, they're checking out, they're making sure basically that you're going to be able to manage the threat of gravity, the threat of an unpredictable prey animal that has its own thoughts and ideas underneath it. And that nervous system is scanning, checking, feeling, but it's not only a negative thing that it's making us. It's making us aroused. It's making us pay attention. It's making us think about and kind of appraise the risk of that cross-country course. It's very, very helpful, and in fact, we probably need it to perform at our best. So from a conversational perspective of talking about this kind of nervous system fear experience with riders, it's really also quite good to reflect on yourself. How do you respond? Your responses are not going to be the same as anyone else's, but if you can talk about your own experiences with your riders and ways that you've managed that, that's going to help them to think, there are strategies. I can work with this. It's not always a negative to have sweaty palms or the butterflies in my tummy. But the nervous system doesn't work by itself for the most part. Go again. So it works with our immune system and our hormone system. So these are our basic kind of control and support teams. Let's click through those. And they, at their core, they are most concerned with not dying. So although this is sort of our basic body learning, this is going to come into the arena with any rider. So these systems do a kind of a check and a balance. So as we're all sitting here, you've got these systems and they'll be working in different ways for you. So when they're kind of working pretty well, the brilliant thing about them is you don't even know they're there. Is they kind of make your body pretty invisible. So you can be goal directed. You're able to think, I want to go and ride that dressage test. I want to go and paint all the fences all in one day. And usually your body will allow you to do that. But what happens when life starts to impact on these systems, because they're a check and a balance, they're trying to keep everything level and even, they will start to increase. And when they increase, you start to feel symptoms. You start to feel things in your body. And one way of understanding as an example would be if you've ever sprained your ankle. So if you sprain your ankle, maybe you've heard it and felt it and you look down and you see it's swollen. So the swelling is your immune system. That's the first part of healing. It also, you can't walk on it. Your nervous system is protecting you. It'll be incredibly sore. But you might, if you think about if the last time you've had an injury, how quickly it puts you in a bad mood. And especially if it stopped you doing something that you care about. So this system is kind of meant to make you go to the back of the cave and curl up and let things heal. But in our modern world, that a lot of the things that will impact on this system are not necessarily always things that we have to stop and rest for. And that's where this gets confusing. Go again, Kristen. So as a physio, I get to ask about, it's my job to know and understand all of these different backstories of these riders. So just click through there. So the things that, no, go back. So the things that are ticked, so when I do some workshops, I call it seat school, so actually teaching people about what's happening in their body and how things work, a bit like us today, but we also have Sven, the simulator, so we get to do it in a smaller group. But the things that are ticked there are probably things for you as coaches to have a little bit of awareness and understanding of how they might affect someone, kind of globally. So, broken bones, joint injury, brain injury, or concussion, I mean, they come from the fact we're dicing with gravity a lot of the time, but it's almost universal that we talk about persisting pain. And that really is those protective systems that have changed their set points and they work in a different way. And also notable to maybe that you might want to do some extra understanding or research for yourself and for others is around menopause and the way that estrogen changes, actually the way estrogen kind of is an anti-inflammatory, essentially, and it takes away another thing that would be keeping your body invisible to you. So that's there's a lot there, but I've got a simpler way, and this is what I've used with my patients for lots of years, and it works kind of for everyone. So you might want to assess your own feelings of how your body is at the moment with this next slide. So, that's good. People always ask that. So it's postural orthostatic intolerance. So it's when you stand up and you get, it's a blood pressure problem. Yep. Good. See, good question. I like. So we can think of the action of those three systems working together, kind of like they give us a traffic light. So we've got a kind of a comfort zone at the bottom when they're just working as they should. And then we've got a survival mode at the top where they're working really hard. That might have a diagnosis attached to it, some of those things in the last slide. And then there's kind of a middle of the road. So first click, you can think of this comfort zone a bit like wearing a really comfy, puffy, fluffy, nice kind of a jacket. So it's almost like it gives you a buffer around. So you could hit yourself and you wouldn't feel it. You feel calm, you're energized, you can do whatever you choose to do in this state. You can push it and you don't feel like it's a detriment. You can do what you want. This is where we kind of thrive and excel. If we really are at the other end, in that survival mode, it might be like going around in a cosy. And even though this is survival mode, it's not so much about being in a armor. It's not more protection. Even though those protective systems are working more, it actually feels more like you're exposed. You're everything, sort of things that wouldn't normally hurt do hurt. Things that you wouldn't imagine could possibly be a problem or be hard to do become difficult. You go to the shops and you come home and have a sleep. This is a really difficult state that is things like maybe our autoimmune conditions. This can be chronic pain, lots of different things. And then we have a middle of the road. And I would say for our modern humans, and this would be most of your normal riders that are coming in for lessons, that are going into competition, that is like wearing just a slightly too tight t-shirt. A little bit scratchy, a little bit uncomfortable. Like it's not the first thing you'd pull out of your closet and you'd want to wear. But this is where we're a bit achy, we're a bit cranky, like, things hurt, like getting out of bed's not so easy, getting up and down of a chair is not so easy. And it's not only body factors that impact on this. You might be thinking the first one is probably things like stress, but it can be just as much things like not having enough social connection, not being a part of things. And people often that, you might find people in that middle state that are actually coming to you from a riding lesson situation as part of their therapy for the rest of life is being with their horse. So it's one of those protective factors. So this might help some conversations or just even your own understanding and awareness of your body and a bit of curiosity for how these things will be there whether someone tells you or not. So if we think now, we'll leave the kind of the human stuff and come back to the saddle. Because these safety strategies or survival strategies, the first place they're probably going to show up in your riders is going to be in the horse's mouth. So if you just reach your hand forward, just kind of play with what your hand would do. Your hand is absolutely wired into your brain to pull back. That position, it doesn't really know anything else to do. But if we think about our skilled kind of rider definition, that actually we need to be able, if we're giving the horse what it needs to perform, it needs that forward elastic contact. So we've got to be able to train a different movement of the upper limb. And the challenge I think we have with a lot of the ways that we teach and learn, and certainly for myself as a learner, is that we don't kind of explicitly break things down, even like we're doing here, of saying, well, we need hand to do this movement, we better retrain it. And I will show you a way that could be effective for you to try and help people find that. But also remember, if we're trying to change something like grippy hands, then we may not be able to do it in the environment that the hands automatically know to grip. Like, I'm also worried I'm on a horse, and that's going to be the reaction that I do. So although we're not going to become better riders if we don't ride, we may again need to find those things that someone can practice and practice and practice off the horse. And then usually it's then finding a cue and something they can think of when they notice that they go to grip and they can do something different. I will show you how that works. Let's go next. Because we also have another thing that happens here that is a safety strategy, and that is holding your breath. And we have all done that. We've all noticed that. We've all done a show jumping course and come out and not taken a breath at all. But what you might not know is that strategy is a default for safety. That is the way that your upper body, your trunk, your torso will sort of splint and stabilize. So its job is to be able to hold and transfer force from your lower body through your upper body. And that's really good if you're stacking hay. That's really good if you're pushing a ute out of a ditch. You need that capacity. It's one strategy. But the other side of that is it also turns us into one big solid chunk, one big brick, and it lifts up our centre of gravity. So then we have other muscles that are going to have to try and compensate and work harder. And I can almost feel as I hold my breath, I go into a bit more of a grippy position there. So we're not going to get riders out of this by saying, just relax, just take a breath. Like, even though we can visually look at it and say, like, that's just what you need to do, like, just do it. We have to usually give the central nervous system something else to do. So that's what we're going to do now. So they're going to kind of transition a bit more. Go, Kristen. So let's transition into maybe some more of the things that we're going to be able to feel and practice. Okay, go. Okay, so we said that we're going to create this splint if we breathe in. So try it, just breathe in, feel it again. That's it. So if we breathe in like that, the answer is let's breathe out. Let's do something different. So I want you to just take a little breath in and then breathe out. Keep breathing out. Keep breathing out. Keep breathing out more than you'd like to do. Take a breath in. And notice you get a nice bigger breath. And then do it again. Breathe out again. Breathe out. Breathe out. Like, put some effort into it. Breathe. 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 Feel it. Make it happen. Okay. So you might be feeling that there's some things that happen in your body when you do that. This time, we could think about even making a sound or trying like a or a bit of a hum, like a just to see what it feels like in that trunk. So just try it again. Little breath in. Let me hear it. Little bit of a hum or a yeah, so we get our vocal area involved. So the kinds of things that you might feel when we do something like that breath out is you might feel some lower abdominal muscles. The way that they work is they kind of almost like pull your skin away from your undies. You might feel those. You might feel your abdominal muscles that attach to your ribs. You might feel them pull down. Sometimes we use a cue like ribs to hips. You might feel that with the breath out. You might feel some back muscles. So a way Just put one more, yeah, sure. We'll come to that. But what they do is if we think of kind of, we can call it a core. I don't love the word, but we can kind of think of this as a cylinder. So your diaphragm that sits underneath your rib cage, actually as you breathe and as you breathe out, it comes up because you're letting the air out of your lungs. So it comes up, and you might have felt your pelvic floor also comes up. So it's kind of this dynamic support, squashes in on the other side, and it almost puts you into like a martial arts kind of ready fighter stance. That's the kind of dynamic stability that we actually need riders to know how to do. So when we put them in the saddle, they're not relying on only their first best guess of their nervous system, which is holding their breath. Yeah? So we could train that a little bit better, and that's what I do with riders. Pilates does fill some of the gaps in this, and I think lots of people go to that. I think that, and I'm certainly interested in developing even some better things that are rider specific for that. But if we go back to that, the other thing that we find with the safety systems then is going to be that we need to add hands in. So if you can, that's right. If you can, I don't think you can reach towards the front of your chair, that's okay. Even if we just try that breath out again, but have your hands here, maybe put them into Rain's position, and just feel that that a forward push can happen from your tummy. It's kind of wired in together. So take a little breath in, and as you breathe out, you're not really even going to move your hands, but you're going to feel there's just almost the idea of going forward, of being able to hold from here, but to also, you're not dropping the contact, but it might be a little tool or a tip that breath out might help you find for a rider that really struggles with these kinds of things, that they can link those two things together. And then they're going to develop a really different sense in their body. Okay, keep going. That movement system is also really important for your spine. You know, you could think that canister, your spine is in the middle. So these are dynamic ways that we stabilise around the spine. Again, this is a lot of why we might use Pilates in a rehab perspective. Does anyone have back pain or ever get back pain? And is it related to riding? Right. Okay, so many riders, we know from the research, say that we get a lot of back pain. And the thing with the back is it's never really designed to work by itself. And sometimes if we don't train a movement strategy that helps support the back, that can be where it gets quite sore, because it is sensitive by design. You could think that your low back, if we think about that metaphor, those garments, those bits of clothing, your low back is always a little bit like it's got a yellow t-shirt on, like it's always ready. And the reason is that the crown jewels of the body, your spine, is there. So your brain is always going to want to know what changes down there. Is that something that is going to have to protect? And I think that what's interesting here is that we're going to practice and try something that actually should be a really familiar thing that we should all be able to feel, which is connecting to the stirrups. But it's also something that riders find really hard. So let's just have a play with this and see. Now, if you can bend forward in your chair, let's try it. So just let your chest come down and just kind of fingers down towards the floor, and then come back up, lift your chest up, and that might not have felt very comfortable at all. For some people it will, some people it won't. But now we're going to try something specific. I want you to imagine I've gone around and I've put oranges under your feet. So the oranges, they're not super squishy, but you can push into them just a little bit. Don't raise your heels. I shouldn't see much happening when you feel the squash into the orange. But let's try and see, can you have a little bit of activity going down into the orange? Roll yourself forward again. Keep the squish. And then push yourself back up from your toes or from those squashy oranges. Now you might notice that gives you a different feeling. If it hurt, it might not take the hurt away, but it should make it easier. And really what it means is that our riding position, where we should also have our contact down to the stirrup, which is really actually a complex skill also that needs to be trained, that will allow the lower limb to take some work. We can add the stirrup and our breathing. So keep squashing your oranges, come forward again, take your little breath in, and then as you breathe out, squash into your feet and push and breathe out, breathe out, breathe out. And it should automatically grow you tall, push down towards the floor, and we're all in a perfect position, hopefully. But, these are the things that we rarely learn, and particularly, with our normal riders, that, we don't ride enough horses a day for enough days of the week, for enough weeks of the year to only be able, to gather the experiential learning and perhaps the eyes on the ground and the feedback to make sure that these kinds of little body skills actually just become our boring normal, that we don't have to think about, because that's actually how skill acquisition works. We get it and then we don't have to think about it, or we're just being able to make small changes as we go. All right, let's go. Oh, finally. Okay, so I'm showing, anytime we talk about rider position, it's taken a long setup for us to get here to the pelvis. But, obviously we all, we know how important the pelvis is to being able to communicate with the horse. That is, whilst we have reins, we have legs, I think when we're making that transition from being a bit more of a passenger, being a bit more of using whatever we've got from our pony club kicks and our rein aids to actually being able to use effective seat and weight aids, there's a transition where you're going to have to teach those riders how to even feel where this bed of their body is. So while you're sitting there now, I know you all know absolutely where your seat bones are, so you can just put a little bit of your brain in your bum and just feel them there, just kind of hold on to that and know that they're there. Because what we might miss a little bit in helping people to learn how their body works is to even have a sense that this area can move. Like I talked about a little bit at the start, this isn't a place, we don't even have that much brain attached, sensory attached to this area. This is an area that we make jokes about, that there's lots of things that go on there, and we're also going to use them for riding. So come and stand up again, if you can. Let's see if we can take an area of your body that you know really well, which is your feet. And you might have done this before and felt this, but it's a good reminder if you have. I want you just to put your brain now in your feet. Feel your feet on the ground, and just to let your weight come forward onto your toes, and to let your weight go back onto your heels, and go forward again, and onto the back. So just exploring what your feet are like, and then see if you can find the middle. So balanced between the two, that's it. And then see if you can just feel your weight go a little bit over to the side, over to the other side. Yep. And just see that there's a little bit of a rotation movement, that if you went onto your toes, you don't really have that movement. If you go onto your heels, you don't have that movement. You've got to be in the middle to have that nice rotation side to side. So keep that little bit of a feeling in your mind and come and sit down and put your brain in your bum, where your seat bones are. So now I'm going to get you to imagine that underneath those seat bones, just like your feet, you've got little feet on your seat bones. Seat feet. I'm not the first person that's mentioned sort of the idea of seat feet, but I think it's a really great way of understanding how this area works. So now we know about feet, so now I could say to you, go onto the toes of your seat feet. And you can get a sense, so I can go forward on those bones. Go onto the heels of your seat feet. Yeah. And there's other joints that have to move to help you go there. None of this area moves by itself. Your hip is going to have to move, your back's going to have to move. But then you can come and find the centre of those seat feet. And if we think about our ideal riding posture, this is always where we want to be. We don't want to be tipped to the front, we don't want to be pushed to the back. There's another kind of magical special reason for why. When you're in the middle, what you've actually got is you've got some rotation movement inside your pelvis. This is the bit that kind of is walking. And unless you know it's there, you might not know that this is another extra part of where we get movement, that we can still keep our upper body still and be able to rotate through the lower body. So try it. Just if you're on the middle of your seat bone, so the middle of your seat feet, just try pushing one knee forward. And see if you can notice that the other one's going to have to come back. If I put you down here on the floor, I could make you walk along on your bottom, forward and backwards. You might want to do that at home. Yeah? But it's not just a movement of your pelvis itself, but it is also, because you have to use your hip to move your bottom bones. But it is a way of being able to feel that you're going to need that in walk, because you're going to have to manage something. If we think about kind of, often the cue is maybe 10 and 2 with that move, with your hip, you actually need that rotation in your pelvis to be able to do that in the most efficient way. You can use a little bit of in a sitting trot. It kind of takes an extra bit of bounce out of things, and we can use it asymmetrically to manage the gaits of the canter. So something to know about, a little thing that you probably use if you're riding but you don't know it's there. And it is a normal movement of this area. You use it in walking, but you can also practice walking on your seat feet, which might be something for your riders. So we talked about lots of really good areas of the body. I'm going to say that this is a little bit of the villain in our story. So this is your hip. So when we're talking about being able to stay neutral on your seat bones and kind of keep a nice round shape here, you've got two hips on either side and they almost always want to pull you somewhere else. They want to be able to be efficient, because we're always going to walk. We're going to be footed as much as we're going to be handed. So one thing that you might want to ask your riders, and maybe you can try this at home, is can you take your boots off without putting your foot down? So can you undo your laces? Can you take your boot off? I would have made it easier if I'd done this earlier, but being able not just to stand on one leg, but being able to kind of manage all of these forces and being able to get it on the ground. If someone usually knows if they can or they can't do that. Because if I stand on one leg, I can cheat. Not if I'm a physio watching, but I can shift over to the side, I can do something else. It's going to show up if I'm actually trying to put some load around there. And if you can't do it on either, your hips have to be stronger than that to be able to manage the forces of the horse. If you can do it on one side and you absolutely can't do it on the other side, that again is going to be something that is probably a good idea to get that rider to just go and see any physio. We should all be able to manage that, just to say, and helping your riders to talk to the physio and understand and say, I need to be symmetrical. I need both of my hips to have good range of motion and both of them to do the same thing and to be able to be strong to manage those loads. Because most people don't know where your hip actually is. It's easy to think it's these bones you can feel up here. It is not. Or the knobbles on the side. It's actually deep. It's kind of on your undies line. It's deep in your groin here. And you can even see how close the joint and your seat bones are. So whilst as a sport, we don't need miles of mobility to do what we do in the saddle. To be able to move your hip to give an aid without taking the seat bones with it, because they usually work together pretty well, that's where you'll probably see on Instagram, like some big ranges of motion that people do to be able to keep seat bones and hip a little bit more separate. So perfectly on time, it's amazing. So that kind of brings me to the end of our field trip through the protective body systems and into how it's going to show up in the saddle, how it's going to potentially be one of those blocks that stops people progressing and becomes frustrating for them. And you felt some things in your body. I should expect you have more questions than answers, because I haven't got time to actually show you what to do about these things. But we have lots of things that we can teach and train riders to do. One more. But from a reflection perspective, because we all know reflection is a lovely part of learning, I've just given you a few questions there that you might like to think about for yourself. And I would just end with saying that I think that, that coaching and the coaches that I've worked with, I think, are absolutely superhero in your ability to watch me, that normal rider over there, doing ridiculous things with my body, to look, basically the way that I think a coach has to work, and there's some research that shows this, is you look at me with your eyes and you feel me in your brain. You feel me in your brain and you have to work out, what does that rider need to do? And what's most magical is that so often, sure, you can't do it in the moment, but wow, you're close. And that is a lot of the way that we learn, and I think it's absolutely extraordinary. I think we can make your job easier if we also equip that body with the ability to do your job with much more ease. That's me done. Thank you very much.